Hi everyone, my name is Sarah Fuentes and I will be talking today about the peripheral arterial disease in public health. I want to start first by introducing peripheral arterial disease, other known as PAD or PAD, which is a disease of the blood vessels or arteries and veins located outside of the heart and brain. It is the most common type of PVD and is often a huge sign of cardiovascular disease depending on how affected the person is. To go more into detail, this disease occurs as a result of plaque buildup. Plaque is made up of deposits of fats, cholesterol, and other substances that block the arterial walls, causing for veins and arteries outside of the heart and brain to narrow. This disease is most commonly known to affect the legs, but it can also harm the arms and abdominal area. By harm, I mean that this disease is known to block these body parts from receiving oxygen, causing for major failures to occur and commonly lead to amputation or worse. Typical symptoms of cold feet, painful cramping, or numbness are usually the start of peripheral arterial disease. However, these symptoms come along with other health issue factors. As seen on this slide, this disease approximately known to have affected 8.5 million people in the US alone, usually those from the age of 50 and above. People around these ages usually have health issues like high blood pressure, diabetes, high cholesterol, or are simply people who smoke. Each of these factors have been known to increase the risks of millions of people as they continue to age. Men have been proven to be more at risk in comparison to women. However, as the rates of PAD male patients increase, so do those of women. Aside from gender, African American men have been known to be at risk by 2 times the rate of their white counterparts. Along with African Americans, Hispanics follow this increasing rate due to high intake in tobacco, poor health conditions, I mean, and poor health conditions over the years. As seen in these maps, in comparison to white Americans, African Americans and Hispanics have an enormous intake on obesity all across the nation by 30 to 35% of most states. Obesity alone is a starting factor to getting peripheral arterial disease. Now, imagine the millions of people who, instead of being obese, they are poor in their health conditions pertaining to cholesterol levels, diabetes, hypertension, high blood pressure, and more. This disease has become a common problem all across the United States, as we continue to see people become victims along the years. Usually, this disease begins to take down people through pain, not allowing them to walk properly or interact in physical activity, then leading to tissue damage or death. Although this problem may not seem to be something that is curable at the moment, it is certainly treatable. Through different methods of physical activity, exercise, healthy eating, and medical intake, patients all across the country can maintain a healthy lifestyle while decreasing their risk of higher peripheral arterial disease levels, meaning avoiding higher risk of coronary disease, stroke, heart attacks, and death. There are thousands of organizations who have worked with people to help improve their daily routines for the benefit of strengthening their body. Research has shown positive outcomes in this type of intervention based on people who have PAD. The REST PAD experiment proved that with the help of a placebo, patients were able to interact in physical activity while keeping a steady rate of glucose levels around with an ABI of 0.90 or less. This is proof that although one may not be able to interact in intense activities, the simple doing of walking can help improve one's health overall. Along with this research, the Fast Track Peripheral Arterial Disease experiment is meant to use technology as a source of knowing how, when, and why patients are experiencing clogs in the arterial walls to then focus on finding a prevention before the clogging occurs. This amazing research is the start to decreasing overall PAD rates and bringing a lifestyle in which people with health conditions do not have to worry about becoming more ill. The future of public health includes all sorts of preventions. In this case, the main prevention one can have now is, of course, carrying out a healthy lifestyle that has been proved and suggested by one's physician. Along with suggestions, awareness is a major prevention that can help impact lives from earlier stages of life, beginning with youth. Rather than exposing people to unhealthy conditions or factors like tobacco, the public needs to be aware of the risks before acting upon any form of unhealthy intake. In the future, I believe that technology will become a large resource in which PAD patients will be able to be given a cure in respect to early prevention rather than late. There should be more intake on how this disease occurs and how to prevent it from spreading along the body. It is in the best interest of public health to decrease the rates of all PAD patients due to their large impact it has had in our nation already. In the following slides, I have posted all my sources. Thank you so much for watching. I hope you learned something new today.